My name is Marko Lukic. I'm a consultant ophthalmologist specialized in retina and Uveitis. I work at Morpheus Eye Hospital Foundation Trust in London, UK. Currently, I serve there as a consultant in virtual clinics. I did in Morpheus 2 fellowships. One was a clinical fellowship in medical retina. The other one was a clinical fellowship in research. I also lecture ophthalmology to optometrists at the UCL and to postgraduate ophthalmology students in University of Zagreb in Croatia. My special area of interest in research is diabetic macular edema and wet age-related macular degeneration. I also have special interest in teleophthalmology and artificial intelligence, where I'm a member of the Professor Pierskin team, which collaborates with the Google's DeepMind. Firstly, I'd like to explain that I'm using Topcon Harmony in my private business entity, which is specialized in teleophthalmology. And I came to that idea on developing such a business or such a way of collaborating with colleagues back in 2018. And I would say the first issue that I had was to find a software which is safe, reliable, fast, which can use different imaging modalities to use to analyze the images and to do a second opinion or to write report on the provided images. And I was thinking a lot about that. So I was thinking whether it's worth that I need to invest my money in that, whether I need to find someone, who can help me with that. But in one way, I was lucky, and that happened in 2018 in Vienna at the Retina meeting, where a good colleague of mine told me about the Topcon Harmony system. And since then, I felt in love in the Topcon Harmony system. So I started to learn about it, started to use it. And what I like the most about it is the vendor neutrality of the system, which means that it is, an option of the system that can support imaging modalities from different competitors. And I found that as a really, really advantage, and that's something which honestly attracted me most to start using the system. The overall platform helps me a lot on different ways. You mentioned the workflow, and indeed, the way how the platform is structured. It helps me to be fast, which is always important. To be, whether you're working privately, whether you're working in a public health system, but also what I like most and what really helps me to be accurate, which is always important when you as a consultant offer the opinion, is to have the features of the system, which Harmony does, to make analysis of the accepted images and to make a proper decision, the accurate decision on what you have received. So, the Topcon Harmony has ability to make comparison with the previous images. So it has option to, define what is the baseline image. You can put the different images on the same screen and analyze them. Also, what, as a retina specialist, I really consider very useful to have multimodal imaging available, to combine them, and based on that, to make a decision. And, if you consider other type of work where you need to open different applications, if you use different platform, different systems, that can be really time consuming. On this way, I would say it really helps me to save my time and to be more efficient, which is I consider always very important. What I said before when I was looking for the ideal system, what I would like to use in my telemedicine business, one of that is safety, and especially patients' data protection. So this always must be a paramount, topic when we consider about reviewing patients remotely. So the system needs to be safe, needs to be certified, which Topcon Harmony is. So this is, I would say, along with the vendor neutrality, another feature of the platform that I really like, that I really respect, that really I consider is important for the users to understand that it's certified, that it follows the GDPR data, the UK protection data, the United States, Australian data protection law. And that is something which really reassures me that I'm using a system which looks after on the patient's data safety. The structure of the platform, I would say, user-friendly way of using the features of the platform are really important. So whatever you use, or whichever platform you use, whichever kind of work you do, I would say, you need to be efficient, you need to be quick, you need to have a stable system which doesn't fall down. And this is something which Topcon Harmony actually is giving you, that stability, that user-friendly way of working on the platform. Then I would also mention the report system. It's something that is really helpful, really straightforward, because I'm using mostly the telereferral part of the platform. My clients or my peers, when they use the platform, they easily can write their part of the report, where they put all necessary information. I receive that, I can read that, I can analyze the images, and then in the same way write the very simple report back and send them to them. In addition to that, reports have option to be highlighted as an urgent. It is also very, I would say, important in terms of the patient safety, because in that way you can always be aware, do you need to act promptly or not. So definitely all those features are something that I personally really like. So I would say that Topcon Harmony is not only helping me to grow my business, but it helped me to start from the idea to the a really practical way of doing telemedicine. And what I mentioned earlier, that vendor neutrality, that the certificates that the platform holds, patients' data protection are important factors that I was looking for, and that's the reason why I'm really happy to continue using it, and I really consider and believe that it will help me to continue that my business grow further.